Hello and welcome back to Jasmine Fields Speaks. I am Jasmine Fields. Today's video is going to be about being your own medical advocate. When you go to your medical provider's offices, whether it is your eye doctor, dentist, OBGYN, family doctor, no matter what medical provider you go to, you will need to serve as your own advocate. So this video is going to give you a few hacks on how you can be your own medical advocate. Teaching you how to do this is really important to me because even though I serve as an advocate in my day-to-day life, I am not my best advocate when it comes to my medical providers, especially when I'm experiencing the fatigue of pregnancy. Not advocating for yourself in this way can be very dangerous. As you probably noticed, I've been offline for a few weeks, and that's because our new addition has arrived to our family. I just want to say thank you to all of those who checked in and really encouraged me to get back on my YouTube channel. That really let me know that I am adding value to people's lives, which is my whole goal for this channel. I also really appreciate those of you who have suggested or requested certain topics be talked about on my channel. I will be sure to research those topics and try to get videos to you as soon as possible. So back to today's topic about being your own medical advocate. On November the 11th, I became violently ill, and as you know, I was about 39 weeks pregnant at that time. I was scheduled for an induction the following week, which was right after my due date. I really just felt like something wasn't right. So eventually I spoke with my husband and said, hey, we probably need to go ahead and go over to labor and delivery. Once we arrived, they did their standard checks, which is essentially just checking to see whether or not you were dilated. They could see that I was having regular contractions and all of my symptoms, that I was 39 weeks pregnant, and yet I was not dilating past a 1. What I attempted to convey to them was the fact that I've never dilated past a 1 on my own. With my first child, my water broke and I still did not dilate past a 1 without Pitocin and eventually a Foley bulb. When we went to the labor and delivery a few weeks ago, I had dilated to a 1, had been having contraction for days, if not weeks, and I still had not dilated past a 1. I did communicate this to the resident. However, standard operating procedure is that unless you are making progress over the course of an hour, they don't consider you to be in active labor, and so a discharge order was put in for me. However, there was a nurse at the hospital who just was looking at the baby's heart rate and decided that she didn't feel very comfortable with sending us home. And even though we had been discharged, she asked if she could just observe us for another hour to make sure that the baby's heart rate and fetal movement was where it should be for her gestational age. Now, at this point in time, I was really fatigued. I had been in a lot of pain. I was not feeling well. And quite frankly, and to be honest, I was in tears when the resident told me that they were going to go ahead and discharge me and send me home. By the time the nurse got there, I was barely talking at all. And so I really left the decision up to my husband as to whether or not we stayed for the extra hour. Thank God he said, yeah, let's just wait it out for the extra hour. We did wait it out for the extra hour, and even though they attempted everything they could to get the baby's heart rate back up and to increase her fetal movement, she just was not cooperating. She was not handling the contractions well, which is very similar to what was going on with Lily when she was born. And eventually they came in and said, hey, we need to either go ahead and do a C-section within the next hour, or you can attempt regular delivery. We did attempt regular delivery for a little bit, but within a couple of hours, they were back in the room saying, this is just not going well and we need to go ahead and get the baby out. And so we went in for our second C-section. Why am I telling you this? I am telling you this because there are certain things that you know about who you are and how you're feeling that your doctor does not know, which is why you need to be your own advocate. So here are some things that I believe you can do in order to be a better advocate for yourself when it comes to your medical providers. The first thing is, remember that you are paying them. That means that your medical provider works for you, and if you decided that that was not the appropriate medical provider, then you could go somewhere else. This is very similar to when you have an attorney. When you hire me as your attorney, I work for you. It is your case. My job is to give you my legal expertise on your case, and at the end of the day, it is going to be your decision what it is that you want to execute with your case. Are there parameters that I, as your attorney, have to work within in order to make sure that I'm adhering to ethical rules? Absolutely. But for the most part, as long as it doesn't violate any laws or ethical rules, I'm going to be doing what it is that you've requested me to do. There is absolutely no difference when it comes to your medical provider. They are going to give you the information they feel like is necessary in regards to what is best for you medically and what is medically necessary. But at the end of the day, it's going to be your choice as to what it is that you want to do with your medical services. Item number 2 is to go into your medical provider's office with a list of questions and then stick to it. I don't know how many times I've been into my medical provider's offices and I've had my questions prepared, but they were so rushed and their tone was so hurried that I felt like it wasn't okay for me to ask the questions that I had prepared. You feel this way in your medical provider's office? A simple question to them as, hey, do you have time for this appointment today? Because I have a few questions in regards to my health. I'm pretty sure that with you posing the question in that manner, they are going to make sure that they take the time to speak with you in regards to your question. By no means am I saying that you should expect 2 hours of your physician's time every single time you go in for an appointment. But if you have questions, I highly suggest that you write them down. That's going to help you and the medical provider stay on the right track and get through the information pretty quickly. You want to respect their time just like you want them to respect your time and not keep you in the waiting area for forever. Number 3 is remember that you know your body and your medical provider does not. That means that you need to help your medical provider by giving them a full list of symptoms that you're experiencing. But just like your lawyer, they don't know what they don't know. So if you don't tell your medical provider what your symptoms are, you cannot expect them to be able to solve your issue. Number 4 is to ask questions. Medical providers are trained professionals. They have an expertise in the area of medicine, and therefore, many times there is medical jargon or medical language that you may not understand. If your medical provider is telling you information and you do not fully understand the pros, the cons, or how it affects you, then it is up to you to ask the question. If you don't express to them that you don't understand what they're saying, then they have no idea that the information that they provided you is not actually helping you. So you must ask questions. People who are around me often know that I am always seeking an understanding. And so they oftentimes will hear me say, let me make sure that I understand this. Use that phrase when you're in your medical provider's office. Let me make sure that I understand what you're saying. And then rephrase it back to them as you understand it. And then they can clarify for you if you are on the right track or if you're not. In all things, seek an understanding. Item number 5 is to not be afraid of rejecting a treatment plan. Medications oftentimes only treat the symptoms and do not get to the source of your problem. If you're interested in the source of your problem, then you should encourage your doctor to do some diagnostic testing. This is a conversation I have regularly with my personal injury clients. If something has been going on with you for longer than 6 to 8 weeks, then I always recommended to my client that they encourage their doctor to do some diagnostic testing to see whether or not they could get to the source of what the issue is. You are able to go to your doctor and request that diagnostic testing be done. Now, I understand that the fear of diagnostic testing is the expense. And so later on, I'm going to record a video for you that will help you understand insurance and what it is that you need to do in order to make sure that you don't get stuck with a large bill when it comes to getting diagnostic testing and other medical treatment completed. But at the end of the day, you must be on the same page with your medical provider in regards to what your treatment plan is. In addition to that, you have to understand that not all doctors are going to be a good fit for you. If you are not really a medicine taker, then a doctor that prefers medications is probably not going to be the right fit for you. If you are a more natural or holistic treatment plan type person, you will need to ask your doctor for natural, holistic type treatment plans or treatment options. But you must understand that just like you have a preference in regards to what you want to put in your body and how you would like to heal, medical providers also have their own preferences in regards to what they feel like works for their patients. So those are 5 hacks that will help you be your own medical advocate. In the comments below, let me know what issues you are trying to overcome with your medical provider. Thank you so much for stopping by Jasmine Fields Speaks. If this video added value to your life, please make sure that you subscribe to the channel so that you don't miss any future life hacks on how to make your life easier, happier, healthier, and wealthier. In addition to that, please make sure you hit that like button so others know that this is a valuable video. This was another video from Jasmine Fields Speaks. I am Jasmine Fields, and I'll help you in the next video.